Okay, so pregnancy is a time that a lot of things in your body, the way your body was using them, all of a sudden it changes. All right. Now this is because you have a third party in your tummy. Do you understand? And this person is also demanding, a certain amount of these things. You understand? So what we are looking at now is what is like folic acid, but we are looking at iron folic. That's like we're looking at the two factors. Do you understand? So in pregnancy, your body can be demanding this. Then sometimes the kind of food you are eating is not what enough to replace the levels in which your body is demanding. So they can now opt in for trying to replace the levels of these things using all those medicines. All right. So iron folic acid therapy, all right, as related to what pregnancy. All right. So it's a widely recommended intervention meaning your body is lacking it, so they want to replace. Okay. So they use it during pregnancy. This is because they want to prevent or treat iron deficiency anemia. They want to also support how a baby is developing and all. You understand? So iron folic acid therapy involves combination of what you are trying to supply folic acid. You are also trying to supply iron. Do you understand? So that's why they say iron folic. All right. Most of the times it is done side by side, but some rare times you have somebody just needing one of it. So they might actually just replace iron only, or they replace only folic acid only. So iron is very good for your red blood cells to be able to what transport oxygen. So they are replacing this iron. This is because let the woman have a better transport of oxygen in the body, so that oxygen can reach the baby, oxygen can be reaching other organs properly. Folic acid is very crucial for DNA synthesis, red blood cell formation, prevention of neural tube defects in fetus. Like give birth to a baby, the baby is having spinal bifida. That means the folic acid was lacking. Do you understand? So the therapy is commonly prescribed for what? Pregnant women mostly, but not only pregnant women. If the person has lost so much blood, all right, if the patient is recovering from surgery, all right, if the person is on kidney dialysis, you can just replace all of this. Okay. So for pregnancy, which is the most common time for this thing to be prescribed, we have about 30 to 60 milligrams of elemental iron. All right, that's daily dose. Folic acid about what 0.4 milligrams should be taken daily. All right. Benefit is there's reduced risks of the mother tilting into what reduced red blood cells, that's anemia. All right. This is because you have a lot of hemoglobin. You also have a lot of what red blood cell formation. It prevents low birth weight and preterm birth, support fetal neural development. Okay. So the common brand names for the drugs you find out there, you have drugs like what Erospan, you have drugs like what Nephron FA, you have drugs like what Covate FE. Please, if you want to know more about any of these drugs, you just have to let me know. So those drugs are a combination of iron and also folic acid. All right, they are also made up of what other nutrients. So they just add some other one or two nutrients, more vitamins and all those what minerals. Okay, just to help strengthen up your body and make you be able to what get used to all those demands that pregnancy has. So but their side effects, it could cause constipation, diarrhea, nausea, abdominal discomfort, dark colors too. We are not saying the side effects must be there, or we are not saying all of the side effects must be there, right? They're usually mild, right? Because most of these drugs, they are friendly. So precautions: avoiding people with hypertensive disorders. It's not recommended for any child under 18 years without medical supervision. So if a child under 18 is taking it, medical supervision should be there. Then a patient shouldn't take the drug till the patient shouldn't take the drug from they are having what? Iron deficiency. Now it will now tilt them to what? Iron overload. That means you overtook the drug, overdose, So as you are taking it, doses should be what? Readjusted. Alright. Now this is, as you are taking it, they are also measuring what? The levels of what you are lacking. Once it is being replaced, they are reducing your dose. You understand? Alright, so that's just what the iron folic acid therapy, alright, replacement therapy simply actually means.